Hi everyone, my name is Abigail Britton and I will be presenting case study 5.1 titled Should Doctors Talk to Relatives Without a Competent Patient's Consent by Oliver Mighton, and you can find this case study on page 298 of our textbook. In this study, Mighton explains that there is a blatant contradiction between what medical students are taught versus what they actually practice in regards to how they handle patient confidentiality with relatives of said patient. Furthermore, he points out that confidentiality is even harder to maintain when working in an open ward where others may hear by no fault of their own or no fault of the doctor. Um, the ethical dilemma that Mighton comes to is whether or not it is appropriate to share information regarding competent patients with the patient's family, and this is because it goes directly against the guidelines of the General Medical Council standards. He notes that while it is ideal to get consent first, it doesn't always happen that way, and while he recognizes that there are occasional risks, the positives outweigh the negatives in his point of view, and in turn his ethical stances, it is more beneficial to involve close family in discussions about care rather than to leave them out, especially if they ask. Morally, this topic can be seen in many ways, but when looking at it from a negative perception, one could see the potential for coercion or abuse from family members, hostility, anything that's really not beneficial to the patient's overall well-being. For example, if a family is informed of a diagnosis that the patient does not want shared, say a terminal illness of a father or an elderly patient, the family is, in most cases, going to want their family member to prolong life as long as possible. They're going to want them to do anything possible. And sometimes the patient just isn't comfortable with that. Sometimes the patient is done. They're done trying, and that's okay. That's their right. They have the right to refuse medical care. And they shouldn't be obliged to coercion, which would be caused directly by the doctor sharing information that they don't want shared. Another example would be a teenager or a wife who is pregnant and doesn't want their spouse or their family member to know because there's physical abusive tendencies in the household. And the doctor sharing this information could bring harm to the patient and to the unborn child, even though that's not what they intended in the first place. Had Mighton used a utilitarianism approach to the subject, in my opinion, he would have came to the same conclusion that he did before. The ethical utilitarian approach suggests, in short, that the needs of the many outweigh the needs of the few. And in a case like this, the universal happiness is going to be greater due to the fact that it gets more people on the same page, more people are involved in the outcome, more people are going to be happy in the end result than had they been left out and felt neglected and felt like they weren't even important in the family dynamic. And also, the patient might feel like they have a shoulder to lean on in that case, and they will have someone to help them and make decisions when their judgment's probably already pretty clouded due to trying to make decisions and make emotional processing choices at the same time. When it comes to social contract theorists like Locke, I believe they would agree in most cases as well with him. According to Locke, when government, or in this case, whoever is setting up the original guidelines, fails to do its job, it is the right of those who are following those rules and are obliged to those rules to do what is morally best in the moment. So, if you take this perspective, one could argue that the General Medical Council has failed to set up clear guidelines that would be applicable to all situations without being too vague. And in turn, it's the duty of those to, morally, it's their duty to interpret it and to make the right decision in the moment, even if it breaks those rules. So, as Mighton says, sometimes involving family members can actually increase the autonomy of the patient, which is the overall goal. So, breaking the rules and revolting is still the right choice. So, in contrast, when looking at the idea of being an ethical doctor, as pointed out by Samuel Gorovitz, one must consider everything from making correct choices technically, like surgically or taking blood, all those little fine details, they have to do that right. But also, they have to make the right choices morally as well. So, one could technically argue that a doctor not seeking consent before sharing information could potentially be placed themselves in a self-interest conflict, where the doctor is seeking the family to persuade the relatives towards a care plan or something similar. Or maybe in a private practice, a doctor is pushing for more than what is necessary, and they think that explaining it to over emotional family members will give them that check that they're looking for. Um, and one could also argue, though, that since the doctor is seeing the family as people with emotions and showing empathy by sharing these details, trying to ease their worries, that the doctor is making the right moral choice by being more humanistic. One of the main criteria for being a good doctor is that, or a good professional in general, is that you aren't looking at your people that you're serving like they're just another number. And in this case, that would show that they're not just another number. It really depends on which rules of that excerpt and that essay of the Good Doctor that you believe in. If you believe that he's making the right choice or not. So, for example, I personally believe that the most important one is that they take into consideration the people and how they feel. And for me, that would obviously fit that criteria. But for other people, they might not, because they emphasize on following the rules, they emphasize on following guidelines to a T over that kind of stuff. But in my own personal view, I would say that as long as the doctor is not blatantly spreading information with hostile family members where there is obvious conflict, as long as they're sensitively sharing the information, so they're not, just saying it with coldly and brushing it off like it's not big news that they just told a family, then it's the right thing to do. And as long as it's not self-motivated as well, because self-bias does really impact people in these positions. So I myself have experience from the patient's point of view, and I might be biased in what I'm about to say, but I'm going to try not to be. For some backstory, I have a chronic illness called pseudotumor cerebri, and it causes fluid to build up on my brain. And I have to get spinal taps, I have to get MRIs, I have to get a shunt put in at some point. It mimics a brain tumor without being a brain tumor. So it causes some severe pain and migraines. And when I first got diagnosed, I went to the hospital with my husband, and I was having really bad sound and photosensitivity. So I couldn't really talk and articulate what was going on and how long it had been going on. So my husband started talking for me and, reminding me of things that I couldn't really articulate at that time. And after a while, the doctors just kind of started talking to him instead of talking to me. I guess they just knew that I wasn't feeling up to it right then. And they knew that he was knowledgeable about the situation. And they never actually got expressed verbal consent from me that he was okay to discuss all this with, that he was the one okay to make some decisions for me. And that sounds like it could be a recipe for me being upset about it, but I wasn't, because they read the situation and they read the vibe between me and him. They read the tone of the room, and they made the right decision morally and empathetically in that moment. But had my husband been aggressive or talking over me or being condescending or passive aggressive or just downright hateful, I would have been offended had they spoke about my care with someone like that before even asking me. That should show just how much it depends on the situation, on if it's okay or not. I personally will say that had they not broken those guidelines, that I probably would have never got my diagnostic MRI, and I would have continued to have been in pain, but they instead listened to their gut rather than the rules, and it paid off. However, as I've said before, it is my own opinion that it is incredibly important for the doctor to read the room. For example, I don't think that any situation in ethics can be the same reasoning for what you believe. I think that it's a gray area. Nothing can fit inside a one size fits all box, and this is just another one of those things that invade the confines of a rule set. Simply because, like anything else in life, there are too many variables to make any concrete decisions that apply universally. Everyone's different. Everyone's family dynamic is different. My grandma raised me, so I would be okay with my grandma asking, and she's going to be worried, so I would be okay with someone sharing something with her without asking me first. But someone else in my family, no, I wouldn't want them to know immediately, and that's the same for anyone else. I mean, no one is going to know your exact family dynamics, but a lot can be read in a room, so it's all on a case-by-case basis, and I definitely agree that sometimes you have to break the rules to make the right ethical decision. So I'm going to wrap this up, and I really appreciate everyone watching this, and I thank you guys for your time, and I look forward to watching everyone else's as well.